The robbery of electrons in human cells is the source of all diseases. Reactive oxygen species, free radical OIS, are electron-deficient substances, unsaturated electron substances. After entering the human body, they compete for electrons everywhere. If electrons are deprived of cell protein molecules, the proteins will be exposed. The upper branch chain undergoes alkylation, forming a distorted molecule that causes cancer. Due to its own lack of electrons, the distorted molecule has to steal electrons from neighboring molecules, causing distortion of neighboring molecules and causing cancer. In this way, a vicious cycle will form a large number of distorted protein molecules. When these distorted protein molecules reproduce and replicate, their genes will mutate, forming a large number of cancer cells, and eventually cancer will appear. Cancer is an extremely dangerous condition, with cancer cells multiplying and spreading extremely quickly, and modern medicine is often at a loss. The characteristics of cancer cells are unlimited and endless proliferation, which consumes a large amount of nutrients in the patient and APO's body. Cancer cells release a variety of toxins, causing the human body to produce a series of symptoms. Cancer cells can also migrate to grow and multiply throughout the body. It can lead to weight loss, weakness, anemia, loss of appetite, fever, severe damage to organ function, etc. In contrast, there are benign tumors, which are easy to remove, generally do not metastasize or recur, and only squeeze and block organs and tissues. Cancer, malignant tumors, can also destroy the structure and function of tissues and organs, causing necrosis, bleeding and infection. The patient eventually dies due to organ failure. The bladder is an important organ of the urinary system. The main function of the urinary system is to produce and eliminate urine. The kidneys produce urine, and the ureters transport the urine produced by the kidneys to the bladder for storage. Once bladder cancer occurs, patients will have irritating urination symptoms, such as frequent urination, urgency, and painful urination, which may be the initial manifestations. These symptoms are similar to benign diseases such as urinary tract infection, cystitis, prostatitis, and kidney stone passing, so diagnosis is often delayed, resulting in late cancer diagnosis and poor prognosis. In addition, some patients and APO's first symptoms are due to tumor metastasis. Systemic symptoms such as fatigue, weight loss, anorexia, and decreased physical and mental function are often signs of disease progression or metastasis, and patients develop systemic symptoms due to renal failure due to bilateral ureteral obstruction. Triple burner. Traditional Chinese medicine divides the human body into three physiological and pathological areas: upper, middle and lower, the upper burner and chest. Including the heart and lungs, the middle burner and the upper abdomen. In terms of anatomical parts, it should include the spleen, stomach, and liver. Gallbladder, lower abdomen, including kidneys, bladder, and small intestine. The large intestine. The function of the triple burner. The triple burner is the path for the human body and APO's vitality, original energy, to rise and fall. The human body and Apos, S vitality reaches the internal organs and all parts of the body through the triple burner. Note, Yuan Qi is the most fundamental qi of the human body and the driving force of life activities. The vital energy is rooted in the kidneys, enters the 12 meridians through the triple burners, and reaches the internal organs. Therefore, the triple burners are called the differential envoys of vital energy. Qihua, traditional Chinese medicine's definition of Qihua, refers to the changes caused by the movement of qi. This change has three forms: assimilation, mutualization, and alienation. Assimilation is the transformation or combination of foreign nutrients into one and Apos, S-own substances, such as the essence of water and grains, natural qi, etc., into human qi, blood, body fluids, etc. Mutual transformation is the mutual transformation between basic life substances such as essence, qi, blood, and body fluids in the body. Alienation refers to the consumption of essence, blood, body fluids, etc. in the process of life activities and decomposes them into useless substances, turbid gas. Among these three processes, mutualization is internal, while assimilation and alienation are manifestations of the relationship between the human body and the outside world. Assimilation, the body takes in from the outside world; alienation, the body is expelled to the outside world. The intake and discharge here constitute the most important link in the human body, and Apos, S gasification activities, and the related organs are the lungs and kidneys. Due to the special status of the lungs and kidneys in the qi transformation activities of the human body, they have been called "sources of qi transformation" since ancient times. The source of transformation is the source of qi transformation. Is it the factor that determines the transformation of qi? The source of alienation lies in the kidneys. The source of assimilation is the lungs. Case 1. Qin Jinchuan, male, 52 years old, is from Nanzhuan Village, Luhuaban, Luqing City, Shaanxi Province, China. First diagnosis, November 9, 2000. Chief complaint, hematuria for more than half a year, and the condition worsened at the end of the last half-month. In October 2000, I had a B ultrasound examination at Luqing City People and Apos, S Hospital, number 11426. A strong light group reflecting 2.30 by 2.43 centimeters was visible on the lower left wall of the bladder. The impression was, solid space-occupying lesion of the bladder. Cystoscopy is recommended. On January 7, 2000, he went to Changji Medical College and Heji Hospital for bladder surgery. Microscopic examination. The result, a solid mass in the bladder, bladder cancer. Surgery is recommended. Because I was afraid of surgery, I asked for traditional Chinese medicine treatment. Came for treatment on November 9, 2000. On the 15th day after taking the medicine, a small amount of flesh-like foreign matter began to be excreted in the urine, the lower abdomen dropped, the swelling of the buttocks disappeared, squatting to defecate was relieved, and the pain in the waist slightly improved. However, he has anorexia, thin and yellow fur, and a thready and rapid pulse. Prescription: add 6 doses of hygiencia, gorgon fruit, Fritillaria fritillary, seaweed, potato meat, Prunella vulgaris and Cortex cypress to the prescription. After taking it, the patient felt that the above symptoms disappeared. The patient went to Luching People and Appos S Hospital for a B ultrasound review on the morning of January 11, 2000. The findings were: the bladder was full, the inner wall was smooth, and no masses or nodules were found. Clinically, when damp heat is used, burns and blood burns are common. According to the syndrome differentiation, this case is due to kidney insufficiency and lack of healthy qi, which can be treated by injecting dampness and heat. Therefore, nourishing yin and nourishing the kidneys are supplemented by Scutellaria barbata and Hediotis diffusa to clear away heat and detoxify. Ren, Hygiene, Eugin, etc. are used to clear away dampness and heat in the lower jiao. It is also supplemented with Astragalus membranaceus and Euchomia ulmoides to supplement the deficiency of qi. In this way, the combination of tonic and purgative medicine can provide both attack and nourishment, tonify but not stagnate, benefit but not injure, and achieve the purpose of treating diseases. In the prescription, amber, leech, qianlong and turtle shell not only have the effect of removing blood stases, reducing swelling and stopping bleeding, but also have certain effects on reversing cancer cells. Bladder cancer recurred twice after surgery. Wang Yong, male, 28 years old, from Makhang Village, Makhang Town, Changji City, Shaanxi Province. Came for treatment on June 24, 2015. Chief complaint: the patient underwent bladder cancer surgery at Heji Hospital affiliated to Changji Medical College on January 4, 2015. After surgery, he followed the doctor's instructions, 4 chemotherapy sessions and taking medicine on time. Examination at Heji Hospital affiliated to Changji Medical College on April 28, 2015, electronic duodenoscopy. A second surgery, radical surgery, was performed at Shaanxi Cancer Hospital on May 15, 2015. The attending doctor specifically told the family that the surgery was completely carried out as a radical operation and reassured the family many times. A review was conducted 2 months after the operation. The patient, accompanied by his family members, went home and strictly followed the doctor and Appos S instructions, eating on time, taking medicine on time, being careful and cooperative day after day. 3 weeks later, the patient suddenly developed lumbar muscle soreness, a heavy back, and difficulty urinating. In the 4th week, visible hematuria and urgent urination and frequent urination appeared. In the 5th week, the lower abdomen dropped and pain during urination occurred. Initial diagnosis: the patient and Appos S body shape is in the middle stage, with a dry complexion, soreness in the lower back, lower abdomen, obvious blood in the urine, urgency, frequency, painful urination, insomnia, upset, and loss of appetite. Chen Hailin prescribes traditional Chinese medicine for bladder cancer, adjusts the medication according to the patient and APO's condition, and prescribes 20 prescriptions for the right medicine. The patient follows the instructions for taking traditional Chinese medicine. On the 40th day of taking the medicine, a small amount of flesh-like foreign matter began to be excreted in the urine. The back pain, swelling and insomnia disappeared, the appetite became normal, the tongue coating was significantly better than before, and the pulse was thin and stringy. Based on the previous treatment, make appropriate adjustments and add antler cream and polygonatum. After taking the medicine, the patient felt that the above symptoms disappeared and asked for re-examination. On August 19, 2015, a urethrocystoscopy was performed at Shanxi Cancer Hospital, Shanxi Third People and APO's Hospital. There had a second checkup on April 28, 2015, and found that the condition had recurred. Radical surgery was performed at Shanxi Cancer Hospital on May 15, 2015. After the operation, the condition was checked for recurrence on June 23, 2015. Originally preparing for the third surgery, I met Professor Chen Hailin under the introduction of relatives and friends. I started taking Chinese medicine on June 24, 2015. After 54 days of Chinese medicine treatment, I was admitted to Shanxi Third People and APO's Hospital, Shanxi Third People and APO's Hospital on August 19, 2015. Shanxi Cancer Hospital for cystoscopy, bladder. The mucosa in the trigone area of the bladder is congested, red, and rough. The tumor disappears, just general inflammation. In other words, Wang Yong was cured of bladder cancer and has been examined since August 19, 2015. There has been no recurrence or metastasis. It will be cleared dynamically in 54 days and return to work. Follow-up on May 1, 2022, he has participated in labor all day for 8 years and is in good physical condition. Case 3. Bladder metastasis after uterine cancer surgery. Xu Kai's, female, 54 years old, lives in Tujiao Village, Huangyudi Township, Luqing District, Changji City, Shanxi Province. Came for treatment on January 5, 2016. Main complaint: the patient and APO's lower abdomen and bladder area have dropped, and the pain has worsened in recent days. After the examination, the patient, accompanied by his family members, came for treatment on January 8, 2016. Weight loss, pale complexion, indigestion, sagging lower abdomen and bladder area, difficulty squatting to urinate, holding back, stuffiness, swelling, and pain, frequent dry stools, frequent urination, hematuria, pale red tongue with sticky coating, and sublingual varicose veins. The pulse is thin, stringy and slippery. Argument: dampness and heat cause accumulation of blood stases, loss of body fluids, and burns to the blood collaterals. Treatment: drying dampness and removing blood stases, clearing away heat and promoting diuresis, dissipating stagnation, and reducing swelling, replenishing qi and blood. After nearly 8 months of clinical treatment, pure Chinese medicine, and more than 8 months of clinical observation, a magnetic resonance imaging examination report was performed at Heping Hospital affiliated to Changji Medical College on September 6, 2017, examination number 11479787, box cavity inspection findings. 3 years after hysterectomy, the uterus is not visible, the vaginal morphological signal is no abnormal, the rectal wall and bladder wall are neat, the ischiorectal fossa signal is normal, the box wall next to the iliac blood vessels and the intrauterine muscles have no abnormal signal, and the bones are not visible. Exception times. Diagnostic opinion, changes in hysterectomy, further examination if necessary. Since the drug was stopped in September 2016, there has been no recurrence, no metastasis, and no medication. The patient has been undergoing one-time treatment, 7 years, and has been participating in housework and agricultural labor. Case 4, bladder cancer, minimally invasive. Patient, Wen Yuming, male, 73 years old, from Nanbin Road, Mang City, Dahong Prefecture, Yunnan Province. Came for treatment on September 4, 2022. Chief complaint: the patient has just had bladder cancer surgery, minimally invasive electrosurgical resection, and has been experiencing continuous dripping urine and blood in the urine, which has worsened in recent days for 3 days. History of current illness: the patient suffered from astringency and pain when urinating, hematuria, and continuous dripping for more than 2 months. After going to the local hospital and taking medicine, it didn't help. Case 4, bladder cancer, minimally invasive. Patient, Wen Yuming, male, 73 years old, from Nanbin Road, Mang City, Dahong Prefecture, Yunnan Province. Came for treatment on September 4, 2022. Chief complaint: the patient has just had bladder cancer surgery, minimally invasive electrosurgical resection, and has been experiencing continuous dripping urine and blood in the urine, which has worsened in recent days for 3 days. History of current illness: the patient suffered from astringency and pain when urinating, hematuria, and continuous dripping for more than 2 months. After seeing the local hospital and taking medicine, it didn't and appos help. The patient took 30 doses of traditional Chinese medicine for 85 days. After enhanced CT examination, no abnormal density enhancement was found. Avoid half a year of chemotherapy and 2 years of local intracavitary perfusion after surgery and go to work healthily. He then followed up in mid-June 2023. He was in good health and continued to pursue his music career. After more than 30 years of practice, Professor Chen Hailin has developed a space for thinking and imagination from multiple levels, multiple systems, multiple directions, multiple dimensions, and multiple channels. Under the guidance of the multidimensional consensus theory of triple burner gasification in traditional Chinese medicine, and organically combined with modern medical diagnostic methods and imaging data, symptomatic drug prescriptions are used to vaporize the gasification center, spleen and stomach in the human body, and carry out gasification. The exchange mechanism rises and falls into the lesion, quickly curbing the spread and metastasis of cancer cells, directly destroying mutated cancer cells to repair missing and mutated cells and cytoplasm. Through multifaceted gasification evolution, the cancer cells are rapidly and steadily reversed to normal physiological cells. Anti-cancer with traditional Chinese medicine is an inevitable choice for the development of world medicine. Author Chen Hailin.